Hi. Firstly, I'd just like to acknowledge the traditional custodians of the land that I'm recording this on today, and I'd like to pay my respects to their elders past, present and emerging, and acknowledge and extend that respect to any other Aboriginal and Torres Strait Islander people and elders from other communities who may be watching this today. My name's Sophie Bond and I'm a practice facilitator with Western Victoria Primary Health Network. Today I just wanted to create a short clip on how to create and submit a successful referral for our primary mental health care services that we commission. So the form is arranged into sections to gather patient eligibility criteria that facilitate prompt allocation of eligible referrals to service providers, as well as provides the minimum Commonwealth data set required for primary mental health services commissioned with Commonwealth funding. So referral allocation to Westvic PHN Commission services requires the submission of a complete information in all relevant sections of the referral form. So that's why I thought I'd create this video, because often the GPs might be experiencing their referrals getting sent back to them for completion because they might have missed a section of the form or not quite understood what they needed to provide. Okay, so I'm going to go through this with you in best practice. So I will start from the word processor utility and I'll just go to templates, and I want to use a template, which will be the primary healthcare referral form. So if we scroll down, there it is, the PHN, Primary Mental Health Care Referral form. If I open that up, it'll want me to select a patient. I'm going to use a dummy patient in our test database today called Maureen, and Dr. Pulse will be her physician today. So what that will do, it will bring up a section where you can select the checkboxes for that to directly import into the referral template. So up the top here, it lists all the services that you can actually refer into. So it's very important just to select one service. If you select more than one service, what that's going to do is that actually is going to unnecessarily delay the service allocation, because we'll need to go back to you for clarification. So it's very important, again, just to select one service. As you can see, this natural disaster, distress and trauma, that service is only available to patients affected by the 2019 and 2020 bushfires. So for the point of this demonstration, I'm going to select Psychological Therapy Services General. Then if you go down the form a little bit more, it'll ask you a Commonwealth question that we're required to answer. For all referrals, has this presentation been triggered by the 2019-2020 bushfires? So I'm going to say no in that instance. Then it's going to ask you what service modality the client prefers. So you can discuss this with your client, and to select multiple selections, that's encouraged, because this client might be happy to see one face-to-face or by video, and that just opens up the number of services that we're able to refer to. Okay, then it comes down to the socio-economic data here. So you'll just need to go through this carefully, but it is recommended that you complete as many of this section as possible to meet the Commonwealth reporting requirements. Also, if you can provide a concession card number, this will enable prompt processing of the referral. So I'm just going to go through and answer these questions for Maureen. No, she doesn't identify as LGBTQI. Her country of birth is Australia, but you can type in what is required there. Main language spoken is English. If she has another language, you can pop that in there. English proficiency, I'm going to say that she's very well. She doesn't need an interpreter. And here you can go through some other socio-economic factors here. Is she homeless? I'm going to say no, she's not homeless. Labour force status, I am actually going to say she's unemployed, or not. I'm actually going to say not in a labour force because she's 97. And you'll continue over here and continue to answer these questions. So employment participation, that's not applicable in that instance. Here, her income. So I'm going to say she's going to have be getting a pension. She's not an NDIS participant. And then it comes down to principal diagnosis. So it's very important. You must enter a principal diagnosis for this referral to be processed. So I'm going to say here that she has an anxiety disorder, and you can opt to put in a secondary diagnosis if she does have more than one diagnosis. Then you'll just go through here and tick which is applicable to this patient. So if you go through, I'm going to say she's not on any of those. I'm going to say, yep, she's on antidepressants, and I am then going to insert that into the template. So if you scroll up, you can see that it has been pre-filled and the patient details have come across too, which makes this very easy. So up the top here, just check yes, you only select one referral service. As I said before, if you select more than one, that's going to unnecessarily delay your referral allocation because we'll need to go back to you for clarification. The next section here, you need to basically go through the questions and tick or put in a cross all the check boxes that are relevant to the service type that you're referring into. So I wouldn't be putting any crosses into any other services. So I'm not going to be using the psychological therapy service suicide prevention, nor the psychological therapy services child or severe and complex, or the natural disasters. Or as you scroll down any of these ones, I selected psychological therapy services general. So I need to go through this and make sure that the patient is eligible. So the patient is unable to access Medicare rebated services? Yes. The patient has not accessed Medicare, so better access in current calendar year? Correct. The only question in this section that you will not need to answer if the patient is over 25 years of age, because it is referring to the patient being suitable for Headspace. So if you're 12 to 24 years old, confirming unsuitable for Headspace, it's not relevant in this instance. So the patient has a healthcare card and other concession card, yes. Mental health treatment plan, we do need to attach a mental health treatment plan, and I'm going to show you how to just cut and copy this out of the patient file. And some GPs get confused and think, well, mental health treatment plan is only eligible for, only created for 12 months, but you don't need to attach one that was created on the day you're doing the referral. It can be a mental health treatment plan that has been created in the 11 months prior. That's fine. So I'll again show you this shortly. Okay, and for this referral, you do need to attach the K10, or for Aboriginal and Torres Strait Islander peoples, the K5, and we'll go through that shortly as well. Okay, then you just scroll down the form and you can see that the patient's details have come across here. And then we get to the socio-economic section that we did answer the questions about previously. So I'd just be confirming that that is all entered in correctly. And if there's anything missing, feel free to type it in here. And here is the clinical details that we popped in there. So we said her diagnosis was the other anxiety disorder. If you scroll down here, we did not select this service. So we did not select the suicide prevention service, but if you did, you need to make sure that you definitely enter into the yellow boxes here. And then we get to the consent form. This is extremely important, because if you do not select yes and have consent from the patient, this referral will not be processed. So you must have completed yes or a no, yes in both of these instances. Okay, and then it'll ask you to do the K10. So you just quickly go through that with the patient and answer the questions accordingly. So I'm going to put here that for our patient, all the answers to this. And the score, you'd enter that in here, which would be 40. And then you also need to answer these questions here. So you just run through these with your patient on the day and make sure that you pop them in here. Just so you know, this section here, that is Commonwealth reporting requirements for all clients receiving services through Westfit PH and Commission Mental Health Services. So it has to be completed. So I'm just going to put in the last 4 weeks, how many days were you totally unable to work? I'm going to put 5. So that one, I'm going to put 20. And I've seen a health professional once. I'm going to put most of the time. Okay, so then we get to the place here where it's actually saying you pace your mental health treatment plan or review here. So if I go back into the patient, I'm going to say I didn't do a mental health treatment plan on the day, but if I go back into correspondence, I can see one was created on the 29th of September. So all I would do is view this and make sure I cut and paste this across. Go back to my word processor and I can just paste that in here. And that's done. So as you can see, it is a fairly simple process, but it does take a little bit of understanding about what is required and why it is required to be able to process your referral. So if you have any questions, please don't hesitate to contact your practice facilitator. You'd send that via secure messaging. If you have any questions around how to do that or how to enter things into your secure messaging service, please just contact your software vendor. Aside from that, thank you so much for watching this clip. I really hope you find it helpful, and if you have any questions, don't hesitate to contact us.